Okay, there we go. Good morning, everyone. My name is Savon Banks. I work as the Training and Evidence-Based Practice Specialist for the California Social Work Education Center, better known as CalSWEC, and I will serve as the moderator for today's webinar. You are attending the webinar entitled California's Most Vulnerable Parents, a population-based examination of youth involved with Child Protective Services. This webinar is sponsored by the Research and Training Network, and we'll start the webinar with a brief introduction of the Research and Training Network. Barrett Johnson, who is the Director of In-Service Training at CalSWEC, will do that with help maybe from Stuart Oppenheim. Stuart Oppenheim is the Executive Director of the Child and Policy Family Institute of California. Then I'll give some housekeeping statements and a brief introduction of the presenters for today's webinar, and then I'll turn it over to the presenters. So Barry, go ahead. Why don't you start your...
Thanks, Yvonne. This is Barry Johnson from CalSWEC, and I just wanted to very briefly welcome you to the webinar and give you a little bit of context about the Research and Training Network. The Research and Training Network has been in existence for about 8 years now, and you can see on your screen our website. It's a partnership between a number of organizations, and it's really dedicated to trying to bring research, practice-oriented research, to emphasize practice-oriented research. You can poke around on the site and learn much more about it. I'm going to show you how to get there briefly from our site. So if you go to the CalSWEC site, the easiest way, of course, is just to use the search box and look for RTN, but I'm going to show you how to get there by clicking. You go to our Evaluation, Research, and Implementation page, and you go down here to our Tier 2 Evaluation, Research, and Implementation Activities to Improve Workforce Practice, and right there is the RTN. Once you're on the site, you can find our entire series of webinars here, and they're all recorded, and you can view them. So we've had a great series of webinars. You can see there's very many of them for you to look at, and there are archived recordings and PowerPoint presentations for all of them. So I invite you to come to the RTN site and look more at it, and also to look at this webinar, which will be posted on the site, and our previous webinar series as needed. We also welcome you to, if you have ideas for webinars for our evidence-informed webinar series, please do get in touch with us. You can get in touch with Savon or me or Stuart, and we can, if you have ideas for that, and we can put them in the queue for additional webinars of this type. So Savon, I believe you are going to introduce our presenters.
I am.
Correct?
Yes.
But I'm excited to have our partners over at the Center for Social Services Research Performance Indicators Project, and also Emily's at USC now, to present this information. They're sort of our data mavens at UC, and they've done some really exciting stuff of combining large data sets, which we're going to hear about today. And it's really sort of pioneering work. So Savon will give them a more formal introduction, but I just wanted to welcome you all on behalf of the RTN and CalSWEC.
Great. So before I give a formal introduction of our presenters, I'd like to make some housekeeping statements. The webinar is scheduled for an hour and a half, so we're scheduled to go from 10 o'clock until 11:30. We've allowed for questions and answers, and we'll have a few natural breaks in the presentation. When you have questions during the presentation, please type them in the chat box because I will be monitoring it during the presentation. Please note that all of the attendees are muted, and that we are recording this webinar, and it will be available on the CalSWEC website after the event. I'll send out a notice when it becomes available, and please share this webinar with your colleagues. At the conclusion of this webinar, we'll also send an online evaluation and would appreciate your feedback because it really helps us as we continue our planning efforts on behalf of the RTN. And for those of you who are seeking CEUs, I will follow up with you after the webinar by sending a certificate via email. Okay, so Now on to my presentation of the presenters. There are 3 presenters today, although there were 4 researchers for this particular project. Emily Putnam-Hornstein is an assistant professor at the University of Southern California's School of Social Work and principal investigator of the Children's Data Network. She also maintains a research appointment at the California Child Welfare Indicators Project at the University of California at Berkeley. Emily's current research involves the linkage of administrative data sources in an effort to improve the health, safety, and well-being of children. Her research has been funded by the Conrad N. Hilton Foundation, H.F. Guggenheim Foundation, First 5LA, and HRSA's Maternal and Child Health Branch. Emily graduated from Yale University with a BA in psychology, received her MSW from Columbia University, and earned her PhD in social welfare from the University of California at Berkeley. Prior to returning to graduate school, she worked as a child welfare worker in New York City. Bryn also joins us today. Bryn King is a doctoral candidate at the School of Social Welfare at the University of California at Berkeley. She's employed as a graduate student researcher at the California Child Welfare Indicators Project. Bryn worked in the field for over 15 years as a provider and director of behavioral health treatment services within a variety of settings, including a residential program for girls in the child welfare and juvenile justice systems. Her research focuses on the well-being of current and former foster youth, and her dissertation examines adolescent child rearing within its population. Her other research interests include cross-system involvement between child welfare and other service sectors, particularly the intersection between child welfare and juvenile justice, race and gender disparities across such systems, the use of residential care in child welfare, and improving social work education. Our third presenter, Barbara Needell, is a research specialist at the Center for Social Services Research at the University of California at Berkeley. She is a recipient of the 2008 Peter Forsyth Award for Leadership in Public Child Welfare for the American Public Human Services Association. As principal investigator of the California Child Welfare Performance Indicators Project, funded by the California Department of Social Services and the Stewart Foundation, she's worked extensively with statewide and county-specific administrative data. Barbara and her team at UC Berkeley collaborate with state and county colleagues to produce and publicly disseminate the data used to support the California Child Welfare Outcomes and Accountability System. She is a member of California's Child Welfare Council, which was created as part of the Child Welfare Leadership and Performance Accountability Act of 2006. So I am going to turn it over to our presenters for today and ask that Emily share her screen so that we can get started with the presentation.
Terrific. Thank you, Simone, for the introduction. And I'd like to start by just thanking the Research and Training Network and CalSWEC for the opportunity to present today. I just want to check out, hopefully everyone is now seeing kind of the slide deck. Yes.
I can see it, Emily.
Great. Thank you. First, just wanted to acknowledge our funders. This research was funded through a grant from the Conrad N. Hilton Foundation. And would also like to acknowledge colleagues at the California Child Welfare Indicators Project as well as CDSS. This work was possible because of ongoing funding that arises from CDSS and the Stewart Foundation, which has allowed us to configure the child welfare data in such a way that linkages such as this, which I'll talk about, we could do fairly quickly and generate lots of new knowledge. And also wanted to acknowledge student partners Jacqueline, Andrea, and Casey who helped with this work. Okay, so just a bit of background. As I think many of you know, because it's actually kind of headlined some articles recently, teen pregnancy rates are at an all-time low in the U.S., have dropped by more than 40% over the last 2 decades. But what happens when you see kind of a dramatic trend like that is then you start to pay attention to what are those groups and where are those areas where perhaps the trend that's observed overall is lagging. And what we are observing is that despite this dramatic decline overall, there exist significant differences by state, by race, by socioeconomic status. And there's also been research suggesting that female youth who have been maltreated or are involved with the child protection system have a particularly heightened risk of teen birth. Unfortunately, in California and actually nationally, we have very little data available to actually look at some of these teen parenting rates and dynamics. Mark Courtney's done some terrific work with his Midwest study, but that of course is relying on just a sample of child welfare involved youth in 3 states. And it's really important that we have these data both because we need to be able to document what is the public health burden of teen births for this population. We need data so that we can monitor trends and evaluate how effective our current pregnancy prevention efforts are. And especially with the recent passage of AB 12 and the extension of foster care to non-minor dependents, we need data that will tell us how are we doing in serving young mothers who may be in the child welfare system, both serving them and serving their children. So for those of you who have heard me present before, you may well have seen this slide, but for those of you who have not, let me just walk you through it, which is that of course we have terrific child welfare data that tells us a lot about the characteristics of youth who are in the system, but unfortunately our CWS CMS system tells us very little about kind of who is giving birth and what the outcomes are for those children. And so what we have been doing both at the Child Welfare Indicators Project at UC Berkeley and now through a new project called the Children's Data Network, which is housed down at USC and funded through First 5 LA, is to begin partnering with our public agencies to explore ways in which we can link data that currently sits in different systems to use that information to generate research that can inform programs and policies on the ground. And so the research that I'll be sharing today is kind of a perfect example of how we have lots of information that sits over with the California Department of Public Health in our vital birth records data. And we of course have terrific child welfare data that sits with the California Department of Social Services. But it's only by linking those 2 data sources that we really kind of get a population level understanding of what's going on with our child welfare population. So today I'm going to be talking about a project where we actually linked over 1.5 million birth records spanning the period from 2000 through 2010 to child welfare records from the state of California spanning the period from 1998 through 2012. Because this funding, our funding for this work came from the Hilton Foundation, which has an LA-specific initiative ongoing, we were able to generate findings that are both statewide as well as LA County specific. Because most of our audience, I believe, is statewide today, we're going to be presenting statewide findings, but I would encourage you to go to the Hilton website if you're interested in LA County specific findings. And we are going to be walking through 5 different research briefs that were generated from these data linkages. I would say that one of the great parts about having millions of records to work with is that you can cut the data a lot of different ways, but that also makes it challenging. And so it took us quite some time to figure out how to kind of best present and use these data. And I think these 5 research briefs will give you kind of an understanding of just how rich the information is. But I'm also really hoping that through this webinar and through other conversations that we receive feedback from others in terms of, we could actually use the data to look at this other dynamic or this question. And so today what we'll be walking through is I'm going to start by just providing some population level information concerning teen mothers in California. I'm then going to turn it over to my colleague Bryn King, who is going to look at 2 different analyses where we examined teen birth rates among girls who were in foster care. Then she's going to turn it back over to me, and I'm going to talk a little bit about how we use the data to explore some intergenerational dynamics, looking at teen mothers who were involved in the child welfare system and the risk of child welfare involvement for their children. And then I will touch briefly upon some of the ways that we've looked at infant health consequences of maternal maltreatment. And what I would like to say now is Siobhan mentioned that we're going to have a few natural breaks. As we transition between these different analyses, I would love to field questions at that point. So please do go ahead and type your questions, because it would be great if this was as interactive as possible despite this being over the web. Okay, so starting with our first analysis, what we were interested in is how many young women who give birth in California do we find evidence that they were previously involved in the child protection system. So anecdotally, we know that a number of kind of teen parents will report that they themselves were victims of abuse or neglect, but we actually don't have any population level information concerning the prevalence of either reported or substantiated maltreatment at a population level. And so what we did for this first analysis is we looked at all teen mothers who gave birth in California in 2009, and we linked them to child protection records that allowed us to go back to 1998 to ascertain how many young mothers who gave birth had a history of child protection involvement. And for those of you who work with CWS CMS, you know that that's our administrative child protection data collection system, and it was only implemented in 1998. We transitioned from an old system to the CWS CMS system, so we only had records back until 1998. So just a little bit about kind of the overall population profile. We were looking at roughly 35,000 teens who gave birth in California in 2009. We did restrict our analysis to teens who had been born in California, and we can tell that from the birth record because it reports where the mother was born. And we did that because if the teen was not born in California, we couldn't be certain when she arrived and therefore what exposure she might have had to the child protection system. So we restricted our analysis that way. In terms of the kind of just some brief demographics, we saw that roughly 5% of teens who gave birth in California that year were between the ages of 12 and 15. You can see that a majority, roughly 2/3, were between the ages of 18 and 19. A majority of teen mothers were Latina, 70%, 11% were Black, and 15% were white. And we also, we can see that this is clearly a high-risk population in that while the majority did initiate prenatal care, for almost 1/3, that prenatal care was initiated only after the first trimester. So the first question we asked was, okay, so we have these 35,000 teens who gave birth in California. What percentage of these young mothers could we identify in a kind of a report in our child protection system, a history of alleged maltreatment? And we found that for nearly 45% of teen moms in the overall population, there was some prior involvement with the child protection system. We also looked at what percentage of these teen mothers had a history of substantiated victimization, and found that a little over 20% of these young mothers had been substantiated as victims of abuse or neglect. And finally, we looked at what percentage of these teen mothers had a history of foster care placement, and we found that roughly 10% had spent time in foster care. And I want to note that these should be viewed as very conservative estimates, a very lower bound kind of proportion of teen mothers. And the reason is that, as you'll remember, we could only go back until 1998. So for all of these teen mothers, we were missing any child welfare involvement or foster care placements that happened during the first few years of life, when we know that, of course, rates of CPS involvement are highest. But we still see that even just going back to 1998, that 45% of teen mothers have had recent child protection involvement. We also just looked descriptively at the characteristics of these mothers and stratified the mothers based on their characteristics to look at differences in the proportion who had been reported, substantiated, or placed in foster care. And so one of the things that you will note is that we were able to break it out by first and repeat births. We saw that for teen mothers where it was a second birth, that almost 60% had been previously reported to the child protection system. We see that younger maternal age was associated with a higher rate of past reported maltreatment. So you can see that for the 12 to 15-year-olds, who were only 5% of our overall adolescent population, that almost 56% of those teens had been previously reported to the child protection system, and almost a third had been substantiated as victims of maltreatment. And we also observed some racial differences in the proportion of teen mothers who had previously been reported, substantiated, and placed in foster care, patterns that largely mirror those we've observed in terms of other racial disparities when we look at child protection involvement. Finally, one of the things that we did is we just looked at what was the alleged maltreatment and the substantiated report of maltreatment for these teen mothers. These are not mutually exclusive groups. So what we did is we looked at whether a teen mother had ever been reported for neglect, whether she had ever been reported for physical abuse, sexual abuse, or emotional abuse. So if there was a teen mother who'd been reported perhaps at two different points in time for both neglect and physical abuse, she would show up in both of these categories. But what we saw was that although the majority of these teen mothers had been, not a majority, but the largest group fell in neglect, that the rates of reported physical and sexual abuse and substantiated physical and sexual abuse were also quite high. Okay, I'm now going to turn it over to Bryn. Actually, I'm sorry. So I promised that any questions, Siobhan, that have come in or that people want to kind of ask about the population level analysis.
Yes, there is a question. Is the substantiation percentage based on the involvement with CPS or based on the entire population of teen mothers? Same question for the percentage that were placed in foster care.
So this is based on the entire population of teen mothers. So if I understand the question correctly, it's did we first look at whether a child was kind of a teen mother had been reported, and then of those who were reported, look at what percentage spent time in foster care or what percentage were substantiated? The answer to that is, and it's a great question, this is going back to the full population. So this is saying that overall of all teen mothers, we found a report for 45%. Of all teen mothers, we found a substantiated report for 21%. And of all teen mothers, we found a foster care placement record for 10%.
Okay, there's another question. Does the CPS data indicate what services the teen moms received when they were in contact with CPS as children?
That's certainly a question that we could look more closely at. The child protection data is we could look at whether kind of a case was opened. We can certainly look at what type of placements they experienced, and that is some of the work that we look forward to doing over the next year, which is diving in a little bit more deeply into some of the longitudinal dynamics of child welfare involvement. And that's also some of the work that Bryn will be talking about next, where we looked a little more closely at some foster care dynamics. But it's a great area in which we have not done any work, but we do plan to.
Great. Do you have geographic data for this by county or zip code?
We do have geographic data, so we've broken it out by LA County, and I have had at least one other county reach out to explore whether it would be possible to generate some of these basic statistics for their county, I would encourage people to follow up with me directly about that. In terms of the zip code level data, yes, this is also something where we likely will be doing some mapping, probably looking based on hospital of birth. But yes, we do have information concerning the geographic distribution.
Okay, great.
Terrific. So I'm going to now turn it over to Bryn. Thank you for the questions. And Bryn, I'll put myself on mute.
Hi, everybody. Can you hear me, Siobhan?
Yes, I can hear you.
Okay, great. So I'm very glad to be here and really excited to be presenting this information to such a diverse audience across the state. It's really exciting to get this information out there. So thank you, RTN, for setting this up, and for Emily for giving me the opportunity to do this work. So that said, as Emily indicated, we wanted to generate some information about what's happening with girls in foster care. So our first study looked at cross-sectional rates of birth for 15 to 17-year-old girls. And we looked at those rates from 2006 to 2010, and basically what we did was we looked at girls who were in foster care during the year and were between the ages of 15 to 17, and we linked those records to girls who gave birth during the same year who were also 15 to 17 at the time of the birth. And we, one of the things that we wanted to do is to really create some kind of statistic that would be comparable to general population rates. Because when we talk about birth rates among the foster care population, that often gets compared to general population birth rates without us actually having a really comparable rate. So this work represents our attempt to do that as best as we could. So I think we could go on to the next slide. I'm sorry, I'm recovering from a cold, so I may start coughing at some point. So the first question is how do these foster care rates, and again these are girls who were in foster care during the same year that they gave birth, how do these birth rates for the foster care population compare with the general population rates? And as you can see from this graph, the lower line, the lighter yellow line, is the general population birth rate for girls 15 to 17, and the darker yellow line, the line on top, is the birth rate for girls who were in foster care during the same year that they were in, that they gave birth. And as you can see, and this is analogous to what we're seeing in the larger population, birth rates for California teens are declining. So they've declined from about 2.2 per 100. These are rates per 100, from about 2.2 per 100 in 2006 to 1.6 per 100 in 2010. As Emily also indicated, because those birth rates are declining in the general population, we're focusing our energies on looking at populations that whose birth rates are not declining, who are still at risk. And we can see that of those girls that were in foster care during each year, their birth rates have not substantially declined. They fluctuate year by year, but generally they're in the same range. Across all 5 of these years, the average birth rate for the general population was about 2 births per 100, while the rate for girls in foster care during the same year that they gave birth was about 3.2 births per 100. So on a relative basis, what we're seeing is that births to girls in foster care are higher, on average about 60% higher, and of course in the more recent years as the general population rate has decreased, that difference is a little larger. But in truth, on an absolute basis, we're talking about a relatively small proportion of girls that are in foster care during the year. At most, about 3.5% of girls in foster care during the year give birth during the same year that they're in care. So again, this is a comparison. Oh, can we just go back one, Emily? This is a comparison that's not quite as rich as we would like it to be, because our general population rates we're not able to address the effect of socio-demographic status, and we know that poverty is strongly associated with teen births. We also know that poverty is associated with foster care and child welfare involvement. So we suspect that if we were actually able to capture income data here, these rates might be closer together. So now we can move forward. So the next question that we had, which is kind of a related point, is to take this foster care birth rate and the general population birth rate and look at how that varies by race. So again, the lighter yellow line is the general population rate, and the darker yellow bar, not line, is the foster care population. And what we see is that Latinas have the highest rate of teen birth, followed by Black adolescents and then white adolescents. And we can see that for the foster care population, birth rates are slightly higher among Black and Latina youth, about 20% higher for Latinas and about 30% higher for Black adolescents. However, we see that there's a real difference between white girls in foster care versus white girls in the general population, and this speaks to the more significant impact of sociodemographic risk, namely probably poverty among this population. And we know that kids in foster care are more likely to be poor. We also know that in the general population, Black and Latina children are also more likely to be poor. So we really see that for white girls in foster care, they are about 3 times more likely than white girls in the general population to give birth between the ages of 15 and 17. And then in terms of racial disparities, in the general population, we see very significant racial disparities between Latinas and white girls and Black adolescents and white girls. And we're talking about for Latinas, they're more than 5 times as likely to give birth as a teen as their white counterparts. However, in the foster care population, we're still seeing disparities, but those disparities are really minimized by the effect likely of those higher rates among white teens giving birth. So we can see that among the foster care population, Latinos are a little over twice as likely to give birth as white girls in foster care, and African American girls are about 50% more likely. We can move forward. So the next thing that we wanted to assess is among this full population of girls who are in foster care and give birth during the same year that they're in care, what is the timing of that birth? Are they giving birth while they're in foster care? Are they giving birth after they leave foster care? Or are they giving birth and then entering foster care? So this graph really demonstrates sort of the breakout of the timing of births and with respect to foster care placement. The darkest yellow bar, the biggest bar, is the group of girls who give birth while they're in foster care, and on average that's about 65% of this population. So the majority of girls who give birth during the same year they're in care are actually giving birth while they're in foster care. But then there are these 2 other groups. On average, about 15% of girls are in foster care, exit foster care, and then give birth, and about almost 21% of girls are giving birth and then entering foster care, which is, I think, one of our more interesting findings from this study is that we are serving a substantial proportion of girls who are getting pregnant or who are having children before they enter care. And then speaking of getting pregnant, we also assess the timing of conception. And so we looked at the average number of days for gestation for this population, and it's something like 275 days plus or minus a few percentage points. And we looked at that full population of girls who were in foster care during the same year who they gave birth. And you can see that on average, less than 50% were actually in foster care at the time that they conceived that pregnancy. So that really speaks to what's happening in terms of our ability to prevent pregnancy. We would, even if we were working doing much more focused work on pregnancy prevention, we would really still only be reaching about half the girls that we end up serving who are giving birth as teens and may or may not be in foster care placement. And then finally, we looked at what were foster care placement experiences that potentially are associated with higher rates of birth. And because we're just looking at these cross-sectional rates, it's not like we can really say anything about whether these are causal risk factors, but these might be potential risk factors that are certainly ripe for further examination, and that's definitely work that we want to do. And as Emily indicated, very excited to receive questions and thoughts that folks have about how to look at what services, what kinds of experiences may increase risk or potentially be protective. So that said, what we observed was that the highest birth rates were among girls who were in care for less than 12 months. And this really makes sense given what we saw previously, is that we're seeing a substantial proportion of girls who are coming into care either after they gave birth, after they got pregnant, or maybe right around the time that they get pregnant. So we're bringing in a lot of girls who are at high risk or already pregnant or parenting, and that speaks to sort of the limited impact that we're going to be able to have in terms of preventing that pregnancy, but it also directs us to the fact that we may need to be thinking about services that they need once they come into care. Another risk factor that was really substantial is those girls that experienced extreme placement instability. So we're talking about 9 or more placements. They had a much higher birth rate. And that makes sense. That's consistent with previous research on the effect of placement instability on a number of different outcomes. We saw somewhat higher birth rates for girls who are reentering care versus those girls who are coming into care for the first time. We saw somewhat higher birth rates for girls who are placed in non-relative foster care, which includes includes both county-based foster care and placement in FFAs. Congregate care, group homes, and shelter care, the birth rates were somewhat lower than for those in non-relative foster care, and then for those in kinship care, they're somewhat lower than the group home care. And I meant to take this little note out at the end of that sentence. Over time, just so that you know what that means, that over time when we looked between 2006 and 2010, birth rates were slightly higher for girls in congregate care, but over time birth rates for girls in non-relative foster care surpassed those for girls in congregate care. And on average, girls in non-relative foster care are more likely or have higher birth rates than girls in congregate care. And finally, in terms of the risk factors, this is consistent with what our previous study indicated, is that girls who are removed for neglect have higher birth rates than girls who are removed for other reasons. And unlike the previous brief, this is an exclusive category, so this is what workers cited as the reason for removal. And then in terms of what might be protective factors, we saw substantially lower birth rates among girls who were in care for 60-plus months, which could be a surprising finding. I think sometimes when we think about who are the kids that are having children in care, we tend to think about our long-term kids in long-term foster care who have been separated from their families for a very long time. And what we're seeing is that those girls who have been in care for at least 5 years have much lower rates, and we expect that those girls might also have more stable placements. So these might be girls who are placed with kin or in guardianship placements that have been stable over that, largely stable over that time period. And then the other factor that might be protective is guardianship placements and other placements, which are a small number of different placements, but mostly guardianship placements, are also, we're seeing much lower birth rates for the girls in guardianship placements. And I think that's it for this study. Savon, do people have questions? I imagine they do. This is a lot of information.
There are some questions.
Okay.
Here's a two-part question. Did your study include American Indian teen girls?
Mm-hmm.
And is there any collaboration with the American Indian Specialty Unit and the Asian Pacific population for teens?
Our study did include Native American and Asian Pacific Islanders. Those we're talking about very, very small numbers, so they're not included here. They're both the number of births to Native American girls were relatively few, and I don't have those numbers off the top of my head, but I can, whoever asked that question can email me and I can get that to them. And the same thing for the Asian Pacific Islander population. And as of now, no, we have not partnered with anybody to do any work to look at that more deeply, and I think that those are important issues. And I imagine that as we move forward, we're going to be able to, this is, when I say there's about 3.5% of the girls in care during the year that give birth, we're talking about something like 400 girls across the state. So this is not a huge population. So when we talk about much smaller populations like the Native American, American Indian population and the Asian Pacific Islander population, it just gets much smaller. So those are good questions and good things to think about and look at moving forward.
Do we have data to show how many of those girls who became pregnant, not in foster care, were receiving in-home CPS services, in other words, family maintenance, because this could present an opportunity for prevention?
We do have that information. We haven't looked at that yet, and that is an excellent suggestion and something that we're going to be taking a look at moving forward.
Is there information as to who fathered these children, if they were the same age boyfriends? Any information about that?
Again, another excellent question, and one of the things that I'm really interested in looking at. We do have that information. And it's limited. So in terms of what's available on the birth record, the only way, first and foremost, the only way that a father gets on the birth record is if he's present at the birth or he petitions to be put on the birth record. So that may limit how much we know about the fathers. But for those birth records in which there is a father named, we do have birth dates, so we know how old they are. So one of the things that we're interested in looking at is taking a look at among teen moms who are either maltreated or in foster care or have had exposure. What are the characteristics of the fathers? Are they present? So are they on the birth record? Are they significantly older? Are they similarly aged peers? We have done a linkage to look at fathers who have been involved in the child welfare system, but because of this limited information on the birth records, we were not able to glean a tremendous amount of information from that linkage, and not able to link a tremendous amount of young men who have had child welfare exposure. But it's a great question, and I think we're thinking about ways that we can use these data to think about fatherhood with respect to adolescent girls who are giving birth.
Okay. Thank you, Bren. Let me just say there's about 4 or 5 more questions, but I want to make sure that you present the other briefs. So I'm wondering if the folks who have questions can hold their questions perhaps, and we can get to them once we finish the presentation. And if not, Emily and Bren, perhaps you might be interested, and if I send you the questions, you could send responses back to me, and I can send them to the entire group if we don't get a chance to respond to them during this webinar.
That sounds good to me.
Okay. All right. So why don't we move on with the next brief?
Okay. So the next brief, so that's the first brief that I just talked about is cross-sectional. So we're looking at a year-by-year basis in any given year who was exposed to foster care and who gave birth during that same year. This next brief, looks at cumulative birth rates among girls who were in foster care at age 17. So basically what we did was we took girls who were who were 17 years old and were in foster care on the first of each year between 2003 and 2007, and we essentially followed them prospectively until through adolescence and assessed who had a first birth as a teen and then who had a repeat birth as a teen. And we looked at and we stratified that by age. So we looked at first birth before age 19, before age 18, 19, and 20, and then who had a repeat birth before age 18 and 19. We can go to the next slide. So to answer that question, essentially what we're finding is that cumulatively the risk of giving birth as a teen for girls who have been in foster care is high. So among girls who were in care at age 17, 11.4% had a first birth before age 18. 19% had a first birth before age 19. Wait, let me just step back because I'm not sure if I said that right. So 11.4% had a first birth before age 18. So by age 17, 11.4% gave birth for the first time. 19% gave birth before age 19, meaning that by age 18 they had their first child, and 28%, a little over 28%, had a first birth before age 20. So cumulatively we're seeing that by age 20, 28% of girls that have been in foster care were in foster care at age 17 end up having a first child. And that is yeah.
And Bryn, this is Emily. I just want to kind of jump in because I know that when I've presented this before, sometimes this can be hard to reconcile because here we are giving you kind of the snapshot view previously and telling you that only about 3.5% of girls who are in foster care give birth during that same year. But then we're also telling you that the cumulative risk is high. And so the important thing to keep in mind is that this is really more of a longitudinal perspective, which tells us that by kind of traditionally youth would have probably exited the foster care system at their 18th birthday, and at that point only about 11.5% of those girls would have given birth at some point during kind of their teen years. But by the time we look out to the end of the teen years, to the age of 20, it's much higher. And so I just wanted to clarify that because I know, Bryn, that previously I've sometimes had questions because here we are saying small annual risk but much larger cumulative risk.
Yeah, absolutely, and I'll just thank you for jumping in, and I'll just also add that we're only looking at girls who are in care at age 17, and that might be a different group of girls who, as Emily indicated, are likely to be emancipating at age 18, and that, or at least prior to the passage of AB 12, and that's generally a unique group, and these are girls that are giving birth after they, this sort of cumulative rate, these girls may be giving birth after they leave care, and certainly for previous years that's going to be true. Anything else to add, Emily, to this?
No, I don't think so. I think the only thing to add is actually that we don't show it here, but we did also look out until age 21, given that California has extended foster care to non-minor dependents through age 21. And at that point, the proportion is about a third. So roughly a third of girls who are in foster care at age 17 will have given birth at least once before the age of 21.
Yes, thank you. Then looking at repeat births, and given what I talked about for the previous study, and talking about maybe our ability to prevent a first pregnancy may be limited. Certainly, once we start working with these young women, we do want to think about preventing a repeat pregnancy. What we're seeing, and this really speaks to that risk, is what we're seeing that of those girls who had a first birth before age 18, that 11.4%, 41%, a little over 41%, end up having a second birth as a teen, and that's fairly significant. So we're talking about, in the in that period, in that adolescent period, they're having 41% are having a second child, and that's a substantial number of girls. Of those girls that had a first birth before age 19, the 31% are giving birth for a second time, and that's also a substantial number. So cumulatively, both a first birth and a second birth is the rates of a first and second birth are pretty high among girls who are in foster care at age 17. And I think that's it for this brief, so I'm happy to open it up to questions, or are we going to save those for the end?
There's one question. Why don't we do this question and then see if there's maybe one more and then move on, because I want to be conscious of the time and make sure that you get to present. There's 2 more briefs, correct?
Yeah.
That's correct. I think we're okay on time. So,
right.
Let's go ahead and take a few questions.
Okay. What is the difference in cumulative birth rate between girls in care at 16 or 15 versus those in care at 17?
We haven't looked at that, and I think that that's an interesting question and one that we might want to take a look at. I think for this study, we were trying to assess and trying to also conduct a study that would produce rates that were similar to what the Midwest study was generating, to really look at this group of emancipating youth or girls aging out of care. So I think that cumulative rate for younger girls is also really important, and it's part of a study that I'm working on and don't have actual figures yet, but I think that it's an important question. But again, we were really trying to construct something that looked at this group that was at the precipice of aging out, and who are these girls and what are their rates of birth.
That's right. And if I could just jump in quickly to say that while I don't remember the numbers off the top of my head, these estimates are remarkably similar to those that were generated by Mark Courtney within the Midwest study. So we're finding something very similar. And although it's not published, I have looked to see whether defining a slightly younger cohort, I did look at 15 and 16, meaningfully changed these rates, and they were very, very similar, in part because you have to remember that many of the 17-year-olds who were kind of in this cohort we were following over time had been in care for an extended period of time. So when we defined our cohort as kind of 1 year earlier, many of those same girls were showing up. It was not a meaningfully different population.
Okay, thank you. Here's one more question. It is surprising that girls who are in placement longer are less likely to give birth than recent placements, and this is paraphrased from your presentation. What possible explanation do you have for this? And this person is asking this question because at one point in time they were all recent placements.
Say that this person is asking the question. Repeat that second half.
Oh, I guess just that for the girls who are in placement longer, they were all in placement recently or more recently as compared to long term. So they're asking, why do you think people who were in placement longer are less likely to give birth than children who were in?
So Bryn, I'm happy to take this one. I think that we want to view that finding very cautiously. I don't think we want to draw too many causal conclusions. I think what's happening is that, as Bryn pointed out, there is a meaningful share of young women where they enter the foster care system because they are pregnant or because they have already given birth, and they come to the attention and something's going on in that home environment that leads to their entry to foster care. And so I do think what's happening is that's kind of, I don't want to say artificially inflating, but it's certainly making the birth rates high for girls who have only been in care for a year or less, because they're entering the foster care system because they are pregnant or parenting. We do not, and this will kind of be some of Bryn's dissertation, we certainly don't have any kind of longitudinal examination to date that would tell us, are the birth rates meaningfully different for girls who perhaps enter foster care and stay there for 5 years, versus girls who spend 6 months in foster care at a younger age and go home to their biological families. That is not something, it's something that we can do with the data. It's not something we have yet examined, and I think it'll be very interesting to see if we uncover differences for those two populations. But for this particular examination, what I would say is that it's really as much a function of recognizing that there are a lot of girls who come into the system only after they've already gotten pregnant or are parenting, and so that's kind of driving up that particular one-year rate versus youth who've been in care for longer periods of time. Bryn or Barbara, anything to add to that, or?
Well, and I've also heard anecdotally, which we did not capture in these data, that girls are leaving care, and they may be AWOL, they may have run away, or they might actually have exited legitimately and getting pregnant and then returning to care. So that also may. That's a sort of anecdotal finding. We did find that birth rates were slightly higher among girls who are reentering care, so that may also speak to that phenomenon as well, to the inflation of that rate.
Terrific. So Siobhan, what I'm thinking is how about we move on to the next brief, and then if there were other questions about the foster care specific findings, we can perhaps field those at the end?
That sounds good. There's no more questions for this one.
Okay,
there was one, but let's move on, and if we have time in the end, we'll get to it with them.
Terrific. So moving on, so we kind of started with this large population-based examination of teen birth rates, and then we moved to looking specifically at youth who were in foster care with these data. And now what we did with this brief is we looked at the relationship between a teen mother's involvement with child protection and the likelihood that the child she gave birth to was either reported or substantiated for maltreatment before age 5. So for this analysis, we focused on the full population of teen mothers who gave birth in 2006 or 2007. You'll notice that we've jumped around with each of these briefs looking at different years. For this particular analysis, 2006 and 2007 ended up being kind of the sweet spot in that it provided us with complete information going back to mom's 10th birthday. And it also provided us with complete information prospectively following children through age 5. And so what we did is let me just go back here. We first focused on mothers. So we took all the teen mothers who gave birth during those years, and we linked those mothers to child protection records to figure out how many of these mothers had been reported, how many of these mothers had been substantiated, and how many of these mothers had no contact with the child protection system. And then through a separate set of linkages, we took all of the children who were born to teen mothers, regardless of whether the teen mother had been involved in the CPS system. So this is the full population of children born in California to teen mothers during these 2 years. And we looked to see what percentage, which of these children was reported for abuse or neglect before age 5, and which children were substantiated for abuse or neglect before age 5. And we looked at both report as an outcome and substantiation as an outcome, in part because we know that a number of people still focus on substantiation, but also because with much of our research we've kind of moved towards thinking about the report to the child protection system as a meaningful signal of risk, independent of whether a particular child protection agency substantiates that report. Okay, so I'm just going to present some descriptive data which in many ways tells a very clear story. So with this first slide, and let me just orient you to the graph because I know there's a lot of information here. What we're looking at on the x-axis down at the bottom is we are kind of following children from birth through age 5. And you can see on the left-hand side of this chart, it reads cumulative percentage or rate per 100. So what we're doing is we are looking at what percentage of children who were born to teen mothers in 2006 and 2007 were reported by age 5, and what percentage of children were substantiated by age 5. And we had the earlier question, are substantiations built off of reports. This is, again, going back to the full population. And you can see here we're showing a gray line. These represent children who were born to mothers where we did not find any report of maltreatment victimization for the mothers when we looked back to her 10th birthday. So you can see that for children born to teen mothers where there was no report of maltreatment, that about 18% of those children were reported for maltreatment at some point between birth and age 5, and about 5% of those children were substantiated as victims of maltreatment between birth and age 5. With this next line, what we've done is we've looked at children who were born to mothers where the mother was reported for maltreatment, but the mother's report was unsubstantiated. And you can see there's a very dramatic difference here. So what we're observing now is that for children who were born to teen mothers where the mother herself was reported as a potential victim of maltreatment, but it was unsubstantiated, that over 35% of those children are reported for maltreatment by age 5, and moving to the right-hand side of the chart, around 11% of those children are substantiated for abuse or neglect before age 5. And finally, we looked at a third group of mothers, and for these mothers, we found a substantiated report of maternal maltreatment victimization when we looked in the child protection data, and we find that almost 45% of babies who are born to teen mothers where the mother herself was a substantiated victim of abuse or neglect were reported to the child protection system before age 5, and around 18% were substantiated by age 5. And just as kind of a side note, I have to say that of all the findings that we have uncovered in these data thus far, this was the finding that I think surprised me the most, because you have to keep in mind that we are already talking about a fairly high-risk subset of all mothers. We're talking about teen mothers where we have a very robust body of literature that suggests that children who are born to teen mothers have a heightened risk of CPS involvement and abuse or neglect. And to uncover such kind of very stark differences in children's risk based on mom's own history of abuse or neglect is something that in many ways makes intuitive sense, but frankly I don't think that any of us had expected to uncover with kind of this degree of difference in the population level kind of administrative data that we have available. I would also note that one thing that's interesting is that, remember, that gray line towards the bottom represents children who are born to teen mothers where we didn't find any evidence of maltreatment for the mother. And those rates, it's a little over 15% and the 5% substantiated, are actually fairly comparable to what we observe for mothers in the population overall, independent of age. So what we're finding is that most of the kind of heightened risk that we observe for teen mothers, children born to teen mothers, according to these data at least appears to be somewhat attributable to the mother's history. And again, this is one of the first times that we've had population-level data for both mothers and children that allows us to kind of tease out these relationships. And just to kind of show you what this looks like after we tried to do what researchers do, which is making more of an apples-to-apples comparison and adjusting for how old was the mother, what was her race, ethnicity, what was the birth payment method, was a father named, other covariates not shown. Kind of the end story is that basically children who were born to mothers who had an unsubstantiated or substantiated report were maltreated at twice the rate of children born to teen mothers where there was no history there. And one of the things I want to point out as well is that we recognize that there could be some pronounced surveillance bias in the sense that if you are a teen mother who gives birth while you have an open case with the Child Protection Agency, or while you are in foster care, that it could be that your child is much more likely than a teen mother who's not in foster care to be reported simply because you have contact with mandated reporters, or perhaps because someone thinks that they are supposed to report your child even though that's not what's supposed to happen. And so what we did with this analysis is we actually excluded all teen mothers who had contact with Child Protective Services as a potential victim themselves after getting pregnant. So we have excluded them from this analysis to try to reduce the chance that we are picking up some surveillance bias that accompanies a mother's own involvement with CPS. And so I just wanted to kind of note that. So I guess, Siobhan, any questions on the intergenerational examination here?
Is private versus public payment method a proxy for income or poverty level?
You know, we did use that as an attempt to proxy birth payment. I'm sorry, to proxy socioeconomic status. What it came down to is, I believe, somewhere between 75 and 85% of teen mothers were covered by public insurance. It doesn't show up in this table, so it doesn't. We did adjust for it, and that was our thinking, that it's a proxy for SES, and it's also a proxy for kind of a little bit of increased surveillance that probably accompanies being a part of a public healthcare system at birth as opposed to a private healthcare system. Okay.
Great. This question is, I think, a general question about fathers. Is asking, have you examined the rate of teen fathers in foster care?
So as Bryn mentioned, we did try to do that. We attempted to do a linkage that was comparable to the linkages we did for mothers by looking at all teen fathers who were on birth records and how many of them had spent time in foster care. But we just felt really uncomfortable with the findings because there were so many missing fathers, and research would suggest that teen fathers are a kind of a group that are very unlikely to kind of be on birth records relative to older fathers. So I do think there's some more work to be done there, but while I think that the child protection and birth record linkages end up being a very powerful way to look at some of the dynamics for young women and mothers, in terms of child welfare involvement, I actually think that other data sources would probably need to be used to look at some of the kind of father and paternal dynamics. Okay. I'm just going to move on to, and this is really the only slide I have for this last brief. One of the things that we also wanted to do is we just wanted to explore what other types of children's outcomes can we look at. And we will be doing much more work around some of the intergenerational dynamics that we observed there. We are working on a study where we look specifically at young women who gave birth while in foster care, looking at what happened in terms of their own placement moves, what happened in terms of their children. But one of the things that we could do with the birth record data is we could look at whether or not a teen mother's history of substantiated abuse or neglect was related to the likelihood that her child was born normal birth weight, which would be defined kind of by the medical literature as greater than 2,500 grams, or was born low birth weight. And we hadn't really expected to find a relationship here, but we did find that a mother's history of substantiated abuse or neglect was a predictor of a low birth weight infant. It was not a very strong relationship. I think it increased the risk by about 6%, but it was statistically significant, and it was after adjusting for maternal age and cigarette smoking and some other kind of correlates of birth weight. And I think this is just an interesting finding in the sense that it's important to keep in mind more and more we're talking about kind of how stress and kind of the environment that mothers and young mothers find themselves in can have health consequences for the next generation. And this is a study where we did observe at least a kind of a correlation between mothers' own history of identified abuse and neglect and the likelihood that kind of the child she gave birth to was low birth weight. So just to kind of, I've got I think 2 slides here just to summarize what we've presented thus far, and then I think we'll have time for just a few more questions, and I hope that, those questions will come in and Barbara and Bryn and I can all jump in there. But I think we're viewing this analysis as we've said here, a start to an important conversation. So as mentioned at the outset, we've had very little data in California historically to look at this. And now we have kind of some very rich data. We're hoping to continue these linkages on an ongoing basis so we can start kind of monitoring how is the population of young women who are involved in the child welfare system or in foster care changing over time, how is the incidence of first and repeat births changing, attempting to kind of tie some of these data to, there are some great questions about cases opened and family maintenance services and kind of more longitudinal examinations. So we've really just kind of started scratching the surface, but we think these data are really important. And of course we're researchers, so we're always driving home, data are important, but we just haven't had much information for this population previously. And I think the other thing to kind of keep in mind from a policy and program standpoint, I think these data are particularly salient given kind of AB 12. These data suggest that more than 1 in 4 young women who are in foster care at age 17, and we have kind of reason to believe would be the most likely to participate in extended foster care as non-minor dependents, will be parenting during her teens. And it's going to be 1 in 3 before age 21. And I think this provides some really interesting opportunities, both in terms of pregnancy prevention during those years where we saw that the birth rates really increased significantly. At 18 to 19 is when most teens who become teen mothers get pregnant and give birth. And so if we have these young women in our foster care system through AB 12, what types of prevention and services can we be offering? And similarly, it also kind of underscores that the state is going to be assuming a much larger responsibility not only for young women but also their children as those birth rates increase during those adolescent years. And so thinking about how we can provide supports and services to prevent some of the dynamics that we saw with the intergenerational child protection involvement, and to make sure that these mothers are supported in their parenting. Okay, so I'm just going to leave this slide up here. More information, fact sheets, etc., can be found on the Hilton website. I have my email address up there, and Sivan can also share Bryn and Barbara's email addresses if you don't have those. And I think we have about 15 minutes to just open it up to any questions that may have come in.
Great. Thank you, Emily. I was going to ask you about the website for the full report, so you have it there, which is great. There's one question here. Although the dialogue can now begin in a data-driven way, are there discussions of funding to support some promising practices to address the startling data?
So the Hilton Foundation organized a convening in LA to kind of showcase and share some of these findings. And I know that there was a discussion about how it is we can bring some evidence-based pregnancy prevention programs that I don't know if anyone from Alameda County is on the phone, but I believe there's been some important work done in Alameda County. And so the question was, is there funding? Can we engage philanthropic organizations to kind of bring that to California at a state level? I know there have also been some discussions around how can we legislatively make sure that these young women are prioritized for subsidized child care slots, et cetera, given some of the findings that are kind of emerging in terms of the intergenerational dynamics. So as I mentioned, wanting to make sure that these young mothers have the necessary supports and services. So I don't think I can answer that now, but I certainly think that yes, this is a start to a conversation about what type of funding is needed and what type of services might be helpful.
Okay, so I don't see any more questions. If you do have questions, type them in. I want to go back to some of the questions that were asked before.
Great.
Okay, how many girls, teen mothers, were children born to teen mothers? Is there a trend that shows evidence that these teens were born from teen mothers?
It's a great question, and we don't have information about that in our data. Of course, the great thing is with every year that passes, we have more longitudinal historical information for child welfare-involved youth, and so we will start being able to look at some of those dynamics. I do know that there was a kind of a national study that was done where the researchers used what's called a life table approach to kind of look at cumulative birth rates throughout the teen years. And they found that one of the strongest predictors was being born to a young woman who was a teen mother. So I believe that there is research that would suggest that is a strong risk factor. It's nothing that we were able to look at specifically with these data.
Okay, thank you for answering that one. I'm going to do a combined question here. This is asking if you looked at mental illness and or substance abuse. Another person is asking about religious background, and another person is asking about educational level.
Okay, so I guess, and Brandon, Barbara, feel free to jump in here if you have thoughts. But what I would say is that we were able to just link two data sources for this particular analysis. The birth records are really just focused on some core demographic health information, whereas the child protection data, as you know, is really for kind of case management and service provision. So we definitely were not able to look at religious background. I think it's a great question. I think it's something where it would probably lend itself to more of a qualitative follow-up with a sample, and I think that there is plenty of literature that would suggest that is kind of a factor. I think the other question had been education. I'm not sure how to answer that exactly. We can certainly. I think the way that I would answer this question overall is it speaks to the potential of, going back to that slide where I said we have all these different data silos. I think the potential to continue, and this is the work that I certainly hope we are able to do, overlaying additional data sources that would allow us to understand at a kind of a deeper level who these young women are. And so you could certainly imagine overlaying substance abuse data to kind of tease that out as a kind of a potential factor. You could also imagine linking these data further with mental health data to both look at kind of services as a potential protective factor and diagnostic information as kind of, what is the risk there. So it's something where I don't know that I can promise any of those findings near term, but I think that's exactly where the Children's Data Network and the Child Welfare Indicators Project hopes to go with research such as this.
Okay, thank you, Emily. Here's one. Any data on the quality of social worker and how that might be a protective factor?
No. It's something that I think we at Berkeley have wanted to do for quite some time, and my understanding is that it can be very hard to track individual workers within the administrative data that we have, because I don't think that we would ever have a measure of social work, kind of the quality of the interactions, but I do think that, given this research, the way that it's pointed towards some indicators of stability as being protective, certainly one would be interested in whether just the stability of having kind of a single social worker over a number of years and the continuity of that relationship, whether that's in fact protective. I don't think that that's something that we're able to track with the data that we currently have, but I think it's a great question. Again, I think the way to think about this study and the administrative data is that it's generating some new epidemiological data that we haven't had, and we really hope that through additional data linkages, but also through using this as kind of a platform for developing kind of more qualitative studies and examinations of this population, that I think that's where a lot of the work will need to be done.
Okay, thank you, Emily. There's a few minutes before we conclude this webinar, so I want to give people an opportunity to ask a question if they would like to do that now. Okay, I'm not seeing anything yet in the chat box. If you have questions, please type them in the chat box. Gary asked a question. I'm not sure if you answered this, but maybe you can expound on it a bit more. As youth age, is the birth rate more reflective of teens in the general population, or does the foster care rate still far exceed the general population? Let me ask that again. As youth age, is the birth more reflective of teens in the birth rate maybe more reflective of teens in the general population, or does foster care rate still far exceed the general population?
So if I understand that correctly, and again, Bryn and Barbara, please feel free to jump in. I think with the analyses that we've presented here today, we were basically defining populations of teens who we knew were in foster care before age 18. I think it's a great question, and we saw that the rates were high, that the birth rates become highest at kind of age 18 and 19, when we were making the assumption that most of these youth had already kind of aged out or emancipated from the system, and in some cases had been reunified with their biological families. So with AB 12, we can certainly, with more data, we will be able to start following and exploring what happens with those teen birth rates, and whether the decision, it may well be that young women who stay in foster care through AB 12, in fact, that their birth rates don't actually look like what we think they will look like, in the sense that right now what we're doing is in this analysis, we followed 17-year-olds in the years after they kind of exited the system to look at how many gave birth, and we found that roughly a quarter were parenting by age 20. It may well be that remaining in foster care through AB 12 is protective, and so that as we follow cohorts of 17-year-olds in the years to come, that the birth rates are not that high, and that's kind of an unanswered question. So I think that there will be much more work to come. And it's a really interesting time because with AB 12, we kind of have this natural experiment where we have some historical data concerning what the birth rates were, and we now have kind of this new program, this extension of foster care, and we'll be able to kind of explore what happens with the rates.
Thank you, Emily. One final question. Have you been funded to continue or move ahead with studies on this topic?
I guess a great way to close. So I mentioned at the outset that this work represents, if you will, the first product to emerge from the Children's Data Network. The Children's Data Network is a new project housed at USC in collaboration with the Child Welfare Indicators Project at UC Berkeley, where we do have funding from First 5 LA to basically set up a platform for the ongoing linkage and integration of data that is currently housed in different public data systems, and to use that data for ongoing surveillance and research and policy analyses. And so through that work, it is our hope that we will be able to continue linking birth and child protection records to not only look at some of these teen birth dynamics, but to also look at children's outcomes and kind of cumulatively in any given birth cohort, how many children are reported, some of the other work that Barbara and Bryn and I have been doing in the past.
Great. Thank you, Emily. I'm looking at the clock. There's 3 minutes, so why don't we conclude the webinar. I'd like to say a very special thank you to all of our presenters, Emily Putnam-Hornstein, Bryn King. I know that Barbara Nadell is in the background. Special thank you to Barry for his presentation of the RTN, and want to remind people to take a look at the RTN website for other webinars. Special thanks to Stuart Oppenheim. He's in the background, I know, also. And thank you all to the people who have participated in this webinar. Emily and Bryn and Barbara, it was such an informative website, very excellent, and want to encourage the people on this webinar to visit this website that Emily has here online. A couple of people have asked about whether this will be available later, and I want to let you all know that we are recording it and we will post it on the CalSWEC website very soon, and I will send out an update probably via ReadyTalk when it becomes available, and want to encourage you to pass the information on to others who you think might be interested in this topic. And again, thank you to our presenters. This concludes this webinar, and I'd like to wish everyone a great day. Thank you all.
Thank you.
Bye.
Thank you.
Thank you. Please stand by.